Hi everyone, welcome back to my YouTube channel. Today we are going to talk about parietal bone. So let's start our topic with introduction. Parietal bones are pair of large curved cranial bones as you can see in diagram. They form a major portion of sides and roof of the cranium. They are situated between the frontal bone and occipital bone and they articulate with several other bones of skull through the sutures. Being flat bone, the primary function is in the protection of brain and in providing attachment for muscles of the head. Location and structure of parietal bone. Parietal bones are located on the superior and lateral parts of the skull. They are roughly quadrilateral in shape and are slightly curved to fit the rounded contour of the head. The inner surface is concave and show grooves for blood vessels, while the outer surface is convex and smooth. Borders of parietal bone. Each parietal bone has four borders. They include frontal border, occipital border, sagittal border, and squamous border. Frontal border articulates with frontal bone at the coronal suture. Occipital border articulates with occipital bone at the lambdoid suture. Sagittal border articulates with the opposite parietal bone at the sagittal suture. And squamous border articulates with temporal and sphenoid bone. Angles of parietal bone. Each parietal bone has four angles that include frontal angle, occipital angle, sphenoidal angle, and mastoid angle. Frontal angle meets the frontal bone and opposite parietal bone at the point of bregma. Occipital angle meets the occipital bone and opposite parietal bone at the point of lambda. Sphenoidal angle meets the sphenoid bone and frontal bone, while mastoid angle meets the temporal bone and occipital bones. Now let's talk about important features of parietal bone. First feature is parietal eminence. That is a rounded prominence near the central of external surface and it is often the point of maximum width of the skull. Next feature is groove for blood vessel. As they are present on the inner surface of the parietal bone and they are present especially for the middle meningeal artery that are more prominent. Next feature of parietal bone is depression for arachnoid granulation. They are small pits on the inner surface where cerebrospinal fluid drain into venous sinus and they are depression for arachnoid granulation on the parietal bones. Now let's talk about articulations of parietal bone. Each parietal bone articulates with five bones. It articulates with the frontal bone. It articulates with occipital bone. It articulates with temporal bone. It articulates with sphenoid bone and it also articulates with opposite parietal bone. Functions of parietal bone. First function is protection, as parietal bones form a hard bony covering for the brain, particularly the parietal lobes. Second function is structural support, as parietal bone contribute to the rounded shape of skull and cranial vault. Third function is muscle attachment, as this bone provide attachment for scalp muscles. Fourth function of parietal bone is sutures landmark, as this bone form key cranial sutures like coronal suture, sagittal suture, and lambdoid suture. Conclusion of this lecture video. Parietal bones are paired cranial bones that form the roof and sides of the skull. They articulate with several other bones and play a cranial critical role in protecting the brain, maintaining skull shape, and serving as landmark for important sutures and fontanelles. Their strong but lightweight structure make them essential component of cranial vault. And this was all about parietal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.